Native TV presents Maternity Voices.
We need to strengthen the VHTs. We need to strengthen the CDOs office to get for us these people. And for us nowadays we have open discussions. So we keep giving our numbers and say, please feel free, it is an open door. You call us anytime and we see if we can reach you. If we cannot, if it is labor, for instance, I want to tell you, if we are alerted early and this person is stranded somewhere, we have the ambulance. We can easily talk to our call center and then we go and pick the client. So we are trying to see how best we can go lower. The kind of service now we need to give and we are giving, for instance, us at Kawaala, we are trying to be down on earth. We are no longer the other health workers you heard about, looking for our clients. We want to understand where they are and we want to try to be as simple as possible with a very simple way. But once we are contacted, cannot fail to reach there. We cannot fail to get an alternative. But area of inadequate staffing, it is a very big challenge. I want to tell you, if I just read for you smaller data that we compiled for a few financial years, you would see a very steady or rapid increment of clients attending at the facility. And when you look at the structure of Ministry of Health, for instance, Health Service Commission, when the structure is passed, maybe they can pass like 3 years back, basing on the population that was there. But because of this sharp increase, in most cases, we are not able to serve our clients because of the demand. The demand becomes high and the health workers are strained. And we are even strained to an extent of going past some shifts, long hours of working, because you want to see that we are able to complete all the shifts. Because if I delay to reach you when you are really crying and calling, Musawa, and I'm still attending to this person, the other person has gone to theater, the other person has taken a referral, then you know that I will have delayed a bit. We as Kawaala, we have 72 established government. But because when you look at the data that I collected here, I would tell you that in financial year 2019-2020, our population currently is 122,300. 122,300. That's the population we're looking at. That is in a financial year. Total women attending. In 2019-2020, we were looking at 13,482. In 2020-2021, we received 31,115. Now in 2021-2022, which was the last financial year, we received 35,656. So we expect even to go to 40 by this financial year. So are you seeing the steady increase? So this means a lot. So when I tell you of 72, that is just a part of the maternity, one department. Now, how about other departments? For the maternity, like maternity in particular, we have only 12 midwives. Remember, this midwife must also become a mother. A midwife must become a mother and have a right of how many months? 3 to 4 months maternity leave. The very midwife should have the right to annual leave. The very midwife can follow sick. The very midwife should go for a refresher training. So having the 12 still becomes a challenge to run. There are 3 shifts divided. We have the day duty that starts from morning up to 5, 8 to 5. Then the other midwives take from around 2 to 8. Then the other one starts from 8 to 8. We go into longer hours. It's a commitment to some extent. Ideally, we're supposed to work for those 8 hours. But you find some of them working for 12 hours because you have to prolong slightly so that you are able to support the people inside.
Maternity Voices is brought to you by Native Voices International in collaboration with White Ribbon Alliance, WRA Uganda. Thanks to support from USAID through East-West management. No woman should lose a life while bringing a life to this world. In Uganda, the high maternal mortality of 326 by 100,000 deaths is preventable if all necessary precaution is taken by, among other interventions, ensuring that all mothers make all the required 8 antenatal visits, have health facility-based delivery, are delivered by qualified and skilled health providers. Mothers are treated with dignity and respect, have access to health facilities are well equipped, hygienic with the necessary medical supplies, health providers are respected, and mother's consent is given before a procedure. For this to happen, we all have a role to play by exercising respectful maternity care, demanding for it, and creating awareness about it. Join us as a partner in the campaign to establish a respectful maternity care. You can start by liking this video, sharing it in your networks, and subscribing to the Native TV YouTube channel for updates on this campaign and other common good initiatives.